As part of Stress Awareness Month, we speak to Dr. Catherine Goodwin, the Assistant Director at WAST for Inclusion, Culture and Wellbeing. So, Dr. Goodwin, what is stress?
We all know what it feels like to feel stressed, but it's not easy to pin down exactly what we mean. When we say things like this is stressful, I'm stressed, we might be talking about situations or events that put pressure on us, for example, times when we have lots to do and think about or don't have much control over what happens, or maybe our reaction to being placed under pressure, the feelings we get when we have demands placed on us that we find difficult to cope with. There's no actual medical definition of stress, and sometimes people disagree over whether stress is the cause of problems or a result of them.
What are the signs and symptoms of stress?
It's helpful to think about them in three sort of broad areas. So emotionally, how we're impacted, physically, and how we might behave. So emotionally, we might find that we're a bit more irritable, a bit quicker to anger. We may be more anxious or afraid. We might feel like our thoughts are racing and we can't switch off. We may find that we're just a little bit lower in mood. We might be depressed, not really interested in the things or people around us. We might feel like we've lost our sense of humour and can't enjoy ourselves. We might feel isolated, lonely, and we might be worrying about our health. Some of the physical symptoms may be in the moment we might find ourselves experiencing panic attacks or shallow breathing. We might find that our eyes feel overburdened. We might have difficulty getting to sleep, and I think particularly within emergency services, sleep is one of the most commonly expressed signs of feeling stressed. We might find that we're grinding our teeth or clenching our jaws more. We might have more headaches, chest pains. We might feel faint or sick or dizzy, and we might notice that our blood pressure is increasing. And then in terms of our behaviours, sometimes people find it hard to make decisions when they're feeling very stressed. They may avoid difficult situations. They might find themselves snapping at people more. And there might be other physical signs, and people might be biting their nails more, picking at their skin. Might find it difficult to concentrate. They may turn to eating too much or eating too little. Sometimes an increase in substance use can happen, so people might find themselves turning to alcohol more often than they would have done, or they might be more restless or being tearful or crying more often.
So, is stress always bad?
I think it's important to remember that not all stress is bad for us. Some stress is good. It helps us perform, it helps us plan, it helps us think, it helps us function. Without stress, sometimes perhaps we wouldn't be able to act when we needed to.
How can we reduce stress?
Make sleep a priority, exercise every day, hydrate and plan.